So good morning students. Good morning, Abhinandan. So we're discussing the hand part 2 today. Yes, good morning. Yesterday we see the part 1 of the hand. So I'm Dr. Pradeep Pawar, Professor of Anatomy. I've got a vast experience of teaching anatomy for the undergraduates and the postgraduates, especially the entrance exams all over India and abroad. Okay, so students, yesterday we had discussed with the first part of the hand, in which we discussed about this arches, the superficial and deep palmar arches. We discussed about this. All things are clear. If there's any doubt, you tell me. We have discussed about the lumbricals, what is the action of lumbricals, the nerve supply of lumbricals, right? Action of lumbricals, flexion at metacarpophalangeal joints and extension at interphalangeal joints. The first two lumbricals which are supplied by medial nerve, and the third and the fourth supplied by ulnar nerve, and paralysis of lumbricals leads to claw hand. Okay, good morning to all of you. Now, then we discussed about the intraossei also, and once again we'll discuss the intraossei for you. Intraossei. Now, what are these intraossei? Intraosseous meaning between the bones. The muscles which are present between the bones are the intraosseous muscles, or the membrane which is present between the bones is known as what? Intraosseous membrane. And students, just for your reference, this intraosseous membrane belongs to what type of joint? If anyone can answer this, intraosseous membrane, what is the type of joint? I'm just asking. If you can answer, that's fine. Intraosseous membrane is a fibrous. It's a fibrous joint. But the fibrous joints are of three types: sutures, syndesmosis, and comphoses. So this is syndesmosis. Syndesmosis type of fibrous joint, the intraosseous membrane. Okay, so I just gave you a reference. Intraosseous meaning between the bones. And now we have got 4 intraossei on this aspect. What are these? Palmar intraossei. 4 intraossei on this aspect. What are these? Dorsal intraossei. Okay, palmar intraossei, dorsal intraossei. Now we all know palmar intraossei does what? Adduction of fingers, and dorsal intraossei does what? Abduction of fingers. Let us understand this intraossei, and then we go to the nerve supply of intraossei, and then the muscle supplied by medial and the ulnar nerves in the hand, and some MCQs, the sensory nerve supply of the hand as well. Okay, so let me start with this. Like yesterday we have discussed this, but still, once again, look. So I draw this as the metacarpal bones here, students. The metacarpal bones. Just give me 2 minutes. These are the 5 metacarpal bones. These are the heads of the metacarpal bones, and these are the bases of the metacarpal bones. I draw this as phalanges, 2 phalanges for the thumb, 3 for the middle index, middle ring, and little finger. Okay, now you tell me, students. The metacarpal bone has 2 aspects. Ab ye lateral hai, thumb, and this is medial. So this is the lateral aspect, and that's the medial aspect. Now the palmar intraossei are said to be unipinnate muscles. Unipinnate, that means they arise only from one bone. The first palmar intraossei arises from the medial aspect of, look at this, the medial aspect of the shaft of the first metacarpal bone. The second palmar intraossei arises from the medial aspect of the second metacarpal bone. The third palmar intraossei arises from the lateral aspect of the third, and the fourth palmar intraossei arises from the lateral aspect of the fourth metacarpal bone, of the fifth metacarpal bone. The first palmar intraossei arises from the first, second palmar intraossei arises from the second. There is no palmar intraossei on the third metacarpal bone. Remember, the third palmar intraossei arises from the lateral aspect of the fourth, and the fourth palmar intraossei arises from the lateral aspect of the fifth metacarpal bone. Now students, this finger is in adducted position. ये जो middle finger है ना, that is already adducted. This is in adducted position only. So what is adduction for the fingers now? Like this, coming towards the middle finger, like this, like this. So tell me now, what is adduction for the thumb? This. So where will the palmar intraossei be inserted? On the medial aspect. Look, the palmar interossei, the first palmar interossei will be inserted here. What is this now, students? What is this? This is the medial aspect. The first palmar interossei will be inserted on the medial aspect of the base of the proximal phalanx of the thumb. Medial aspect of the base of proximal phalanx of thumb. So when it contracts, it takes the thumb towards the middle finger. The second palmar interossei is inserted on the medial aspect of the base of the proximal phalanx of the index finger. So that's adduction. The third palmar interossei is inserted on the lateral aspect of the base of the proximal phalanx of the ring finger. So that's adduction. And the fourth palmar interossei is inserted here. So that's adduction. Up clear, students? So this is the palmar interossei. I hope this is clear to all of you. So what is the action of palmar interossei? Adduction of fingers. Look, there is no palmar interossei for the middle finger. Remember this, because this middle finger is already in adducted position. This is already in adducted position. So no palmar interossei for this. So for this, palmar interossei is inserted here on the medial aspect. Here medial, this is lateral and this is lateral. So this is adduction of fingers. The palmar interossei is supplied by which nerve? Can anyone comment on this? The palmar interossei. I just told you this. They are supplied by ulnar nerve. All the palmar and dorsal interossei are supplied by ulnar nerve. Now just tell me, students, if this is adduction for the middle finger is already in adducted position. So what would abduction for the middle finger be? This would be abduction on this side and this would also be abduction. मतलब दोनों sides पे there is abduction. For the middle finger on both the sides is abduction. So clear, that's about the palmar interossei. Now understand this dorsal interossei. Understand the dot. Is this clear? I'll clear this off. Students, ये clear है? बोलो. If it's clear, just put your thumbs up. That's it. So I proceed. This is the simplest way to represent a palmar interossei. Okay. Okay, fine. Now coming to the dorsal interossei. Okay. Now coming to the dorsal interossei. Just have a look here now. Dorsal interossei. Dorsal interossei are said to be bipinnate muscles. So they are dorsal interossei. Let me just draw this for you. So this are the metacarpal bones. Now, the dorsal interossei are said to be bipinnate muscle. What is bipinnate? That means the dorsal interossei will arise from two bones. Look, the first dorsal interossei arises from the medial aspect of the first metacarpal bone and the lateral aspect of the second metacarpal bone. Medial aspect of first and the lateral aspect of second. The second dorsal interossei arises from the medial aspect of the second and the lateral aspect of the third metacarpal bone. Right? The third dorsal interossei arises from the medial aspect of the third and the lateral aspect of the fourth metacarpal bone, and the fourth dorsal interossei arises from the medial aspect of the fourth and the lateral aspect of the fifth metacarpal bone, like this. So they arise from two bones. Though bones they arise. So there's a dorsal interossei is said to be what? Bipinnate muscle. This is what we call as bipinnate muscles. Okay. Now tell me, what is the action of dorsal interossei? Look, dorsal interossei does abduction for the fingers, abduction. Okay, this abduction for the fingers. Now tell me, students, for the thumb, there's a special abductor. For the thumb, we've got a special abductor. I've not told you that, but yes, it's a muscle of thenar eminence. There's a special abductor for thumb, that is abductor pollicis brevis. So no dorsal interossei for this, because it's a special abductor. For the little finger, there's a special abductor. What is that? Abductor digiti minimi brevis. So no dorsal interossei for this little finger also. Understanding? Because we've got special abductors for these two fingers. So no abductor for this. Now we are left with three fingers. And how many dorsal interossei do we have? Four dorsal interossei. We've got three fingers. Now what is abduction for this? This way. It is away from this finger. This is abduction. What is abduction for the ring finger? This way. So where would the dorsal interossei for the index finger be? On the lateral aspect of the base of the proximal phalanx, lateral aspect, yahan pe. So this would be abduction. Where would the dorsal interossei for the ring finger be? On the medial aspect. So this is abduction. Ye abduction ho gaya, ye abduction ho gaya. Look, I'll just make this for you. So this was already adducted. So what is abduction for this? This. What is abduction for this? This. So where would we place the first dorsal interossei? Here on the lateral aspect of the base of the proximal phalanx of the index finger. The dorsal interossei will be placed here on the medial aspect of the base of the proximal phalanx of the ring finger. So ye abduction ho gaya, ye abduction ho gaya. And now you tell me, for this finger which is already in the midline, for this finger which is already adducted, this is also abduction and this is also abduction. So there will be two dorsal interossei for this finger on either sides, though dorsal interossei. So this is also abduction and this is also abduction. Clear? Is this clear to all of you? So this is dorsal interossei and how they are placed. Fine. So what is the action of dorsal interossei? Abduction of fingers. Palmar interossei is adduction of fingers. All the dorsal and palmar interossei are supplied by what? Ulnar nerve. Okay, that's it. Any doubts in this? Then we proceed. Now, I start with the hand. We start with the muscles of the hand. What is this eminence here? What is this eminence? Thenar eminence. What is this eminence? Hypothenar eminence. There are three muscles in this thenar eminence. Two superficial hote and one is a deep muscle. Here also two superficial, one is a deep muscle. So 3 and 3 muscles here. Before that, tell me students, who supplies the skin over the thenar eminence? Who supplies the skin over the thenar eminence? That's the palmar cutaneous branch of medial nerve. You remember this? The skin over the thenar eminence is supplied by the palmar cutaneous branch of medial nerve. And who supplies the skin over the hypothenar eminence? Do you remember this? The palmar cutaneous branch of ulnar nerve. And both these nerves go above the flexor retinaculum. Both these nerves go above the flexor retinaculum. Okay, so I'll just start with this. Muscles of thenar eminence. If you know, you tell me. Thenar. Which are the muscles of thenar eminence? Take a minute before I start. Just understand, this is very important. Tell me now, what is this for the fingers? This. What is this for the fingers? Flexion. That's flexion for the fingers. What is this for the fingers? This. Extension. Ye flexion hai, ye extension hai fingers ka. What is this for the fingers? Abduction. And what is this for the fingers? This, adduction. So this is abduction and this is adduction. Fine. Now, if you see the first metacarpal bone, the thumb, the first metacarpal bone is not in line with the other fingers. As in here, it's not in line. The first metacarpal bone is turned by 90 degrees. It is rotated medially by 90 degrees. Clear? So, if these are the fingers, the first metacarpal bone is turned medially by 90. So, movements of the thumb would be at right angles to these fingers. So, now you tell me, if that's flexion and that's extension for the fingers, for the thumb at right angles, this is going to be flexion and this is going to be extension for the thumb. If this is abduction and adduction for the fingers, for the thumb at right angles, this is going to be abduction and this is going to be adduction. Abduction and adduction. Clear? So see the movements of the thumb. This is flexion, this is extension, this is abduction, this is adduction, and what's this? Opposition. Now understand. The muscles of thenar eminence, there are 3 muscles in the thenar eminence, 2 superficial and 1 deep. The first superficial muscle, the first one, which is on the lateral side, pulls the thumb out like this. It pulls the thumb out. What is this action? Abduction. So what is the name of this muscle? Abductor pollicis. It's a small muscle. It's a short muscle. So what do you call this as? Brevis. So what is the name of this muscle on the lateral side? That's abductor pollicis brevis. The second muscle here, it pulls the thumb down. So what would you call this as? Flexor pollicis brevis. And you remove these 2 muscles, the third muscle is going to do this. What is this? Opposition. So what is the name of this muscle? Opponens pollicis. So which are the muscles of thenar eminence? I'll just write this down. Abductor pollicis brevis, flexor pollicis brevis, and the third one is opponens pollicis. All these muscles of thenar eminence are supplied by whom? The medial nerve. Just remember this, students. Who supplies the muscles of thenar eminence? Medial nerve. Except the flexor pollicis brevis. इसके दो heads होते हैं. There are two heads for this. One is the superficial head and the other one is the deep head. One is superficial and one is deep head. Out of this, the medial nerve supplies all the muscles except, can anyone answer this? Except the deep head of flexor pollicis brevis. Except the deep head of flexor pollicis brevis, which is supplied by ulnar nerve. This should be clear. Okay, so these are the muscles of thenar eminence, abductor pollicis brevis, the flexor pollicis brevis, जिसके दो heads है, superficial and deep, and the deep one is the opponens pollicis. The nerve supply of all these muscles is medial nerve except the flexor pollicis brevis, the deep head, which is supplied by ulnar nerve. Just remember this. Now, what is this eminence? That's the hypothenar eminence. ये है hypothenar eminence. Again, same three muscles here. Two superficial muscles and one deep muscle. Now tell me, the first muscle here is going to pull the little finger out. So what is this action? Abduction. What is the action? What is the name of this muscle then? Abductor digiti minimi brevis. The second muscle is going to pull the little finger down. So what is this? Flexion. What is the name of this muscle? Therefore, flexor digiti minimi brevis. And you remove these two muscles. The third muscle is going to do this. What is this? Opposition. Name the opponens digiti minimi. Opponens digiti minimi. Okay. Let me just write this down for you. So hypothenar eminence. Hypothenar eminence. Just the names you have to know, and the nerve supply is very important. Hypothenar eminence. Abductor digiti minimi brevis. Flexor digiti minimi brevis. Opponens digiti minimi. And what is the nerve supply of all this? Ulnar nerve. The nerve is ulnar nerve. Okay. So that's about the thenar and the hypothenar eminence. Now with this concept, students, now starting with the nerve supply of the hand. Extremely important topic. The nerve supply of the hand, or what is the median and ulnar nerve supply in the hand? What is the cutaneous nerve supply of the hand? This is extremely important. Chalo, we'll start now. Have a look. Understand this. Now, median nerve. What does it supply? The median nerve. How does it enter the hand? Come on, be interactive, students. Come on, answer this. How does the median nerve enter the hand? Through the carpal tunnel. It passes through the carpal tunnel. The moment the median nerve enters the hand, now what does it supply? It supplies the three muscles of thenar eminence. The three muscles of thenar eminence, we know this. And it supplies the first and the second lumbricals. The first and the second lumbricals. So it supplies the three muscles of thenar eminence and the first and the second lumbricals. Clear? So that is total 5 muscles which are supplied by the median nerve in the hand. Median nerve in the hand. 5 muscles. So let us begin with this. Muscle supplied by median nerve in the hand. Median nerve in the hand. There are plenty of MCQs on this, so understand this. What are the muscles supplied by median nerve in the hand? 1. Abductor pollicis brevis. Abductor pollicis brevis. Flexor pollicis brevis. Which head of it? Superficial head. Opponens pollicis. First and second lumbricals. First and second lumbricals. So total of 5 muscles the median nerve supplies in the hand. Just be clear about this. So abductor pollicis brevis. Abductor pollicis brevis, the flexor pollicis brevis, uska superficial head. The third is the opponent's pollicis. So 3 muscles of thenar eminence, 2 lumbricals, the first and the second lumbrical. So total of 5 muscles supplied by median nerve in the hand. But students, this median nerve supplies many muscles in the forearm. The median nerve and its branch. The median nerve and its branch supplies many muscles in the forearm. And these muscles in the forearm are used to lift what? Weight. The muscles in the forearm are used to lift weight. Median nerve is therefore known as what? A laborer's nerve. Median nerve is therefore known as a laborer's nerve. Correct? Median nerve is known as laborer's nerve. Now coming to the muscle supplied by ulnar nerve in the hand. Ulnar nerve. Muscle supplied by ulnar nerve in the hand. Now tell me students, how does the ulnar nerve enter the hand? Yes, how does the ulnar nerve enter the hand? The ulnar nerve enters the hand through the Guyon's tunnel, right? Through the Guyon's tunnel, it passes below the volar carpal ligament, correct? It goes below the volar carpal ligament, it enters the hand. The moment it enters the hand, it divides into 2 branches, a superficial branch and a deep branch. The moment the ulnar nerve enters in the hand, it divides into a superficial and deep branch. Now this superficial branch is sensory. The superficial branch is cutaneous, sensory. It supplies the skin here and it supplies a small muscle which is inserted into the hypothenar eminence. What is the name of this muscle? Can anyone tell me? The superficial branch of ulnar nerve supplies a muscle which is inserted into the skin of the hypothenar eminence. Any guesses? Any guesses? What is this muscle which the superficial branch of ulnar nerve supplies? Yes, come on students. Yes. Yes, Abhinandan. Yes, Abhidev. Arun. What is the name of this muscle which the superficial branch of ulnar nerve supplies? And this is very important. You got my point? You understood what I'm saying? This the ulnar nerve. Dekho, ulnar nerve. How does it enter the hand? Through the Guyon's tunnel. Once it enters the hand, the ulnar nerve gives 2 branches. One is the superficial branch, one is a deep branch. Correct? The superficial branch of ulnar nerve is sensory. It is a cutaneous nerve. It supplies the skin here. What skin, that I'll tell you. And it supplies a muscle here. A muscle which is inserted into the skin of the hypothenar eminence. Yes, and this muscle is the palmaris brevis. Palmaris brevis. So which is the other branch? The deep branch. Okay, the deep branch of ulnar nerve. And this deep branch supplies 15 muscles. It is going to supply 15 muscles. Let us just see the 15 muscles which are supplied by the ulnar nerve. 1. Abductor. If you know, you answer this. Huh? Abductor. Digiti. Minimi. Brevis. Abductor, digiti, minimi, brevis. Second. Flexor. Digiti. Minimi, brevis. Third, opponents, digiti, minimi. Fourth, third, and the fourth, lumbricals. Third and fourth lumbricals. 4. Palmar intraossei. 4. Dorsal intraossei. Adductor pollicis. Adductor pollicis. And the last one, deep head of flexor pollicis brevis. The deep head of flexor pollicis brevis. Just be very clear about this. The 15 muscles supplied by the ulnar nerve in the hand. Students, for you, The 15 muscles supplied by the ulnar nerve in the hand. One is the abductor digiti minimi brevis. Second is the flexor digiti minimi brevis. Third, the opponent's digiti minimi. Next, the third and the fourth lumbricals. The four palmar intraossei. The four dorsal intraossei. One muscle of the thumb which does this, and this. What's this? Adduction. So adductor pollicis. And one muscle in the thenar eminence who's supplied by the median nerve. That's the deep head of flexor pollicis brevis. The deep head of flexor pollicis brevis. I hope this is clear. So after supplying all these muscles, okay, the ulnar nerve, the deep branch of ulnar nerve supplies all these muscles, and then the deep branch goes and ends in a muscle. It goes and buries itself in a muscle. What is that muscle? Can anyone tell me? This muscle, the ulnar nerve, goes and buries itself. That's the end of ulnar nerve, and this muscle is therefore called as the graveyard of ulnar nerve. The graveyard of ulnar nerve. Any guesses? Out of this 15 muscles, who's known as the graveyard of ulnar nerve? Graveyard. That's the adductor pollicis. Graveyard of ulnar nerve. The graveyard of ulnar nerve is adductor pollicis. I hope this is clear to all of you, students. Okay. Fine. So that's it. So that's about the muscle supplied by the median and the ulnar nerves in the hand. Just have a look at this MCQs, and then we go for this cutaneous nerve supply. Answer this. Median nerve lesion at the wrist causes all the following except. Come on, students, you can answer this. Median nerve lesion at the wrist causes all the following except. Come on, students. See, when the nerve is injured, the muscles are paralyzed. Okay? When the nerve is injured, the muscles are paralyzed. So the muscles shrink, they become small in size. And what is this known as? Atrophy. Atrophy. So median nerve lesion, weakness of the first and second lumbrical will be there, Aman. It will be there, no? Dekho na, just think. Think. Now I have given you all the muscles supplied by median and ulnar nerve. You can guess this, students, easy hai. Dekho, we'll go to the options. Median nerve lesion at the wrist. So thenar atrophy, is it correct? Thenar atrophy hoga ki nahi hoga? You tell me. Thenar atrophy will be there because the median nerve supplies the muscles of thenar eminence. And when the muscles of thenar eminence are paralyzed, they will shrink, they become small in size, and that's atrophy. So thenar atrophy is correct. Okay, thenar atrophy is correct. Weakness of adductor pollicis, क्या बोलते हो? This is wrong, students. ये wrong है. This is the answer because adductor pollicis is supplied by whom? Adductor pollicis. Come on, now you answer. Adductor pollicis is supplied by whom? Not the median nerve. No, it's not the median nerve which supplies the adductor pollicis. Who supplies the adductor pollicis? The ulnar nerve. The ulnar nerve supplies the adductor pollicis. Right, the adductor pollicis in fact is known as what? The graveyard of ulnar nerve. Graveyard of ulnar nerve, that's adductor pollicis. Weakness of the first and second lumbricals? Correct, yes, it causes weakness of the first and second lumbricals. Weakness of the flexor pollicis brevis. Now tell me, students, which head of flexor pollicis brevis will be involved? The superficial head. And a superficial head will be involved because the deep head is again supplied by which nerve? Ulnar nerve. So which head of the flexor pollicis brevis would be involved? The superficial head. And yes, there will be weakness of flexor pollicis brevis. Complete paralysis nahi hoga. There will be weakness. And weakness of the first and second lumbrical, that's fine. Or paralysis you say here. That's correct. So answer is B for this. Any doubts? Your students you have, you tell me. Any doubts? Okay, fine. Answer this. Just wait, Yash, wait. Okay, answer the students. Answer is C. Very good. Abductor pollicis brevis. Very right, very right. So damage to the ulnar nerve at the wrist will spare. Damage to the ulnar nerve at the wrist would spare. Fourth lumbrical, yes. Damage to the ulnar nerve at the wrist would spare what? Fourth lumbrical, yes, it would spare the fourth lumbrical. The flexor pollicis brevis, which head would be involved? Which head of the flexor pollicis brevis be involved? The deep head. The deep head of flexor pollicis brevis would be involved. The superficial head is supplied by medial nerve, so that would be spared. The deep head would be involved. Superficial head would be spared. Abductor pollicis brevis, this is totally supplied by whom? Medial nerve. Abductor pollicis brevis is supplied by whom? Medial nerve. And all the dorsal and palmar intraossei, they are supplied by whom? The dorsal and the palmar intraossei are supplied by ulnar nerve. So out of this and this, out of B and C, if you have to select one, tell me what are we going to select? Out of B and C, what is more appropriate? क्या लगता है आपको? What would be the better answer? Yes? Chandan? What do you think is the better answer out of B and C? C is a better answer. C is always a better answer because abductor pollicis brevis would be completely spared. Ulnar nerve does not supply abductor pollicis brevis, so ये completely spared होगा. Whereas flexor pollicis brevis का half will be paralyzed and half would be spared. Who will be paralyzed? The deep head. And who will be spared? The superficial head. Okay, very good to all of you. So this is what we have just answered. Now we'll start with the cutaneous nerve supply of the hand. Students, the cutaneous nerve supply, देख लो ये. पहले understand this cutaneous nerve supply of the hand. Okay, just one moment. Give me 2 minutes to draw this slide. बहुत MCQs हैं hand पे. There are plenty of MCQs on the hand, so be clear about all this. So that's the thenar eminence, that's the hypothenar eminence. These are the phalanges. Okay, fine. So that's the thenar eminence, that's the hypothenar eminence. Tell me students, now who supplies the skin over the thenar eminence? Boliye. Who supplies the skin over the thenar eminence? Come on students, you answer, be interactive, so you'll understand it better. This is difficult and this is important. Tell me, who supplies the skin over the thenar eminence? That is the palmar, I'll just write this down for you, palmar cutaneous branch of medial nerve. Palmar cutaneous branch of medial nerve, and this is the palmar cutaneous branch of ulnar. Palmar cutaneous branch of ulnar nerve. Okay, so the skin over the thenar eminence is supplied by the palmar cutaneous branch of medial nerve, and the skin over the hypothenar eminence is supplied by the palmar cutaneous branch of ulnar nerve. ठीक है? And you know what is the importance of these two nerves? Both these nerves go above the flexor retinaculum. Students, याद है? Both these nerves go above the flexor retinaculum. We had written this. This is the palmar cutaneous branch of medial nerve, palmar cutaneous branch of ulnar nerve. Both these nerves go above the flexor retinaculum. Now, medial nerve supplies how many muscles in the hand? The medial nerve supplies 5 muscles in the hand. And after supplying these 5 muscles, the medial nerve now supplies the skin on the palmar aspect of 1, 2, 3.5 fingers. 3.5 fingers. The skin on the palmar aspect of 3.5 fingers. Look at this. This is 1, this is 2, this is 3, and this is half a finger. So skin over 3.5 fingers, this much skin is supplied by whom? Medial nerve. Medial nerve. Now the same medial nerve goes to the dorsal aspect. The medial nerve who supplies this 3.5 phalanges here, 3.5 fingers, complete 3.5 fingers, the same medial nerve goes to the dorsal aspect, again supplies the distal phalanx of the thumb, the distal and the middle phalanx, distal and the middle phalanx, and distal and middle half. This is median nerve. Be very clear. मतलब ये सारे phalanges को supply करता है यहाँ पे, all the phalanges, proximal distal, proximal middle distal, ऐसे. So it supplies 3.5 fingers on the palmar aspect. All the phalanges. The same median nerve goes to the dorsal aspect. Again supplies 3.5 fingers except proximal phalanx. Except the proximal phalanx. It doesn't supply proximal phalanx. Okay, now coming to this 1.5 fingers. अब बाकी क्या है? This 1.5 fingers. So this 1.5 fingers would be supplied by whom? Yes. Now, ulnar nerve supplies how many muscles in the hand? 15 muscles, correct? Ulnar nerve जो है, it supplies 15 muscles in the hand, and after supplying this 15 muscles, the ulnar nerve, the superficial branch, supplies 15 muscles. I mean, the deep branch, I'm so sorry, supplies the 15 muscles. The superficial branch is going to supply what? The skin. It supplies a muscle here, palmaris brevis, and then it supplies the skin on the palmar aspect of 1.5 fingers. So ये क्या होगा? The superficial branch of ulnar nerve. Superficial branch of ulnar nerve. The same superficial branch goes to the dorsal aspect, supplies the distal and middle phalanx and distal and middle half. So that's the superficial branch of ulnar nerve. Is this much clear, students? So देखो, thenar eminence is clear to you. The palmar aspect is clear to you. Palmar aspect. Chalo, answer this palmar aspect at least. Who supplies the skin over the thenar eminence? Thenar, that's a palmar cutaneous branch of median nerve. Palmar cutaneous branch of median nerve. Who supplies the skin over the hypothenar eminence? Hypothenar eminence is the palmar cutaneous branch of ulnar nerve. Palmar cutaneous branch of ulnar nerve. This 3.5 fingers are supplied by whom? Median nerve. This 1.5 fingers are supplied by whom? The superficial branch of ulnar nerve. Superficial branch of ulnar nerve. Now, coming to the dorsal aspect. The same median nerve goes to the dorsal aspect, supplies 3.5 fingers except proximal phalanges. The superficial branch of ulnar nerve goes to the dorsal aspect, again supplies 1.5 fingers except proximal phalanges. Except the proximal phalanges. अब बाकी क्या है बच्चों? What are we left with? We are left with only the proximal phalanges. Look, we are left with only the proximal phalanges of this 5 fingers and the dorsum. 5 fingers के proximal phalanges बाकी है and the dorsum. So look at this, the proximal phalanges of this 2.5 fingers. Students, it's 2.5. Huh? First we used to say 3.5, but now it is 2.5. So the proximal phalanges of this 2.5 and the dorsum, this would be supplied by what? This would be supplied by the superficial branch of radial nerve. This is supplied by the superficial branch of radial nerve. What is left for us? What is left is this 2.5. This is supplied by what? This is supplied by the dorsal cutaneous branch. Dorsal cutaneous branch. Dorsal cutaneous branch of ulnar. This is supplied by the dorsal cutaneous branch of ulnar. Be very clear about this. So this is a cutaneous nerve supply of the hand. Very important. I'll repeat this once again for you. Once you've done with this, you tell me. That is dorsal cutaneous branch of ulnar nerve. You can't see this. दिख नहीं रहा है. This is dorsal cutaneous branch of ulnar nerve. I hope this should be clear now. Dorsal cutaneous branch of ulnar. Is this clear, students? Perfect. Perfect. The cutaneous nerve supply of the hand, is it clear to all of you? Just once again, I'll repeat this for you. Cutaneous nerve supply of the hand. The skin over the thenar eminence, that's a palmar cutaneous branch of medial nerve. The hypothenar eminence, that's a palmar cutaneous branch of ulnar nerve. 3.5 fingers supplied by medial nerve. 1.5 fingers on the palmar aspect is the superficial branch of ulnar nerve. Coming to the dorsal aspect, 3.5 fingers except the proximal phalanges. 3.5 fingers except the proximal phalanges. Who supplies this? Medial nerve. 1.5 fingers except the proximal phalanges. Who supplies this? The superficial branch of ulnar nerve. Superficial branch of ulnar nerve. Now the proximal phalanges of 2.5 fingers and the dorsum. This is supplied by the superficial branch of radial nerve. Superficial branch of radial nerve, and this 2.5 and the dorsum is supplied by the dorsal cutaneous branch of ulnar nerve. Dorsal cutaneous branch of ulnar nerve. Is this clear? Yes, Chandan. Palmar is easy. Dorsal thoda sa difficult hai, but that's fine. Once, twice, thrice you revise, it will be easy. Okay. Now I'll just tell you something about this nerves. If you're done, you tell me. Understand this. Ulnar nerve. ये जो ulnar nerve है ना, ulnar nerve in the hand gives superficial and deep branch. ये ना MCQs ऐसे आते हैं, देखो, just try to be clear with your concepts. Where does the ulnar nerve divide into a superficial and deep branch? It divides into the hand, in the hand. मतलब in the hand, the ulnar nerve divides into a superficial and deep branch, and in the forearm, or before the flexor retinaculum, in the forearm before the flexor retinaculum, it gives these two branches. This is the palmar cutaneous branch and dorsal cutaneous branch in the forearm. So I just want you to be clear about this. अगर ये clear होता है ना, you understand the lesions of ulnar nerve. Lesions. मतलब where does the ulnar nerve give the superficial and deep branch? In the hand. In the hand, the ulnar nerve gives the superficial and deep branch. Where does the ulnar nerve gives this palmar cutaneous and dorsal cutaneous branch? Yes, the dorsal and the palmar cutaneous branch is given in the forearm, at the wrist, in the forearm. You understanding this? So why is this so important? Why am I stressing this, bacho? Because if the ulnar nerve is injured in the hand, देखो, understand this. If there's an injury to the ulnar nerve in the hand, then there will be a paralysis of the 15 muscles. Superficial and deep branch kya? What is the deep branch supply? 15 muscles. So 15 muscles are paralyzed. You get a claw hand of the last 2 digits. Last 2 digits ka claw hand hoga. Plus this is the deep branch involvement. The superficial branch. What is the superficial branch supply? The superficial branch will supply this 1.5 fingers on the palmar aspect and 1.5 fingers except the proximal phalanges on the dorsal aspect. So this much motor and this much sensory loss is going to be there. Now, which sensations are going to be intact if the ulnar nerve is injured in the hand? Conscious sensations, which sensations are going to be intact? The skin over the thenar eminence is going to be hypothenar eminence is going to be intact, and the skin on the dorsal aspect is going to be intact. Why? Because these two nerves are given where? In the forearm. ये दोनों nerves कहाँ देता है? In the forearm. You understanding? But now see, tell me students, if the ulnar nerve is injured in the arm or in the forearm, then 15 muscles will be paralyzed, plus there will be a complete sensory loss. Complete sensory loss होगा यहाँ पे. Because all the nerves are gone. Deep gone, superficial is involved, the palmar cutaneous branch is involved, and the dorsal cutaneous branch is involved. I hope you are understanding this. Okay, fine. I hope this is clear, students. Bolo. Yes, very good. And now you tell me something about the median nerve. Median nerve. Now, the median nerve, how does the median nerve enter the hand? How does the median nerve go into the hand? Through the carpal tunnel. The median nerve enters the hand through the carpal tunnel. Perfect. And how is this branch of median nerve going to the hand? This branch goes above the flexor retinaculum, which is this branch which supplies the skin here. That's the palmar cutaneous branch. The palmar cutaneous branch of median nerve goes above the flexor retinaculum. Students, are you understanding? The median nerve, how does it enter the hand? Through carpal tunnel. But the palmar cutaneous branch ये flexor retinaculum के ऊपर से जाता है. It goes above the flexor retinaculum, and that is how when there's a carpal tunnel syndrome, when the median nerve is involved in the carpal tunnel, there'll be a paralysis of this fine muscles which are supplied by median nerve. There'll be a claw hand of the index finger and the middle finger. Yes. Plus sensory loss. कितना होगा sensory loss? This 3.5 fingers on the palmar aspect. The skin will be involved, 3.5 fingers on the palmar aspect, and there will be a loss of sensations on the dorsal aspect of 3.5 fingers except proximal phalanges. 3.5 fingers except the proximal phalanges. Utna sensory loss is going to be there, but which sensations are going to be intact? Which sensations are going to be intact? The skin over the thenar eminence is going to be intact, and this is how we know that the median nerve is injured in carpal tunnel. So ये sensations intact होंगे and these sensations will be lost. That's how you know that the median nerve is involved in the carpal tunnel. But suppose if the median nerve is injured in the forearm or in the arm, then there will be a loss of sensations here. There will also be a loss of sensations here. I hope this is clear to all of you. ठीक है, is this clear, students? Just tell me if this is clear. I'll show you one very good MCQ. Have a look at this. Yes, answer this MCQ. See you. A 55 years old woman, yes, very good. A 55 years old woman with a history of severe depression presents to the emergency with having cut deeply into the flexor retinaculum of her wrist at the level of the carpal tunnel. She has no sensations on the palmar or the dorsal aspect of the distal parts of the middle and the index finger and half of the ring finger. देखो, distal, middle and half of ring finger. The moment this comes, you have to know there's something to do with the median nerve. Median nerve का कुछ होगा. 3.5 fingers, that's median nerve. Which of the following has been compromised? Yes, the answer is median nerve. Very good. Answer is median nerve. Can you tell me, students, something about the flexor carpi radialis? How does the flexor carpi radialis enter the hand, students? How does this flexor carpi radialis enter the hand? Flexor carpi radialis. I'd drawn this for you. I'd drawn the carpal tunnel for you. I'd drawn the flexor retinaculum for you. याद है ये? How does the flexor carpi radialis enters the hand? Through the flexor retinaculum. The flexor retinaculum divides into two, and what enters through this is the flexor carpi radialis. Palmaris longus कैसे जाता है? From above the flexor retinaculum. Ulnar nerve passes through the Guyon's tunnel, and the median nerve goes through the carpal tunnel. It goes through the carpal tunnel. Is this clear to all of you? Okay, so this should be clear. Tell me, what is this test? ये क्या टेस्ट है? इसमें क्या करते हैं? What do? We tell the person to place his hand on the dorsum of the hand on the table like this. We tell the person to place the dorsum of hand on the table, and we bring a pen here, and we'll tell the person to touch this pen with the thumb like this, with the thumb like this, like this, like this. So what is this test known as? And what muscle are we testing? What muscle are we testing? समझ में आ रही है? We tell the person to touch the pen, tip of the pen with the thumb. So what are we doing? We are testing for the abductor pollicis brevis. We are testing for the abductor pollicis brevis, and who's going to supply this abductor pollicis brevis? The median nerve. And what is this test? Known as the pen test. Pen test. So pen test is for abductor pollicis brevis. That's for the median nerve. Pen test is for the abductor pollicis brevis, the median nerve. Clear to all of you? Okay. Now tell me, students, what is this? What is this test for? So I'll give you 2 minutes to identify this. Students, come on. Any guesses? Any guesses? What is this test for? You tell the person to hold a piece of paper between the fingers. Hold the paper between the fingers, and you try to pull the paper. The person is holding the paper between the fingers. You try to pull the paper apart. So what is this action of the fingers? Adduction. So what muscle are we testing? Which is the muscle which does adduction of the fingers? The palmar interossei. Palmar interossei does adduction of the fingers, and this test is known as the paper test. Paper test. And what is this for? Adductor. No, this is for palmar interossei. Card test also it is known as card test. Card. Card test for palmar interossei. Right, so palmar interossei क्या करते हैं? They do adduction of fingers, and this is for to test the palmar interossei. Tell me, students, now what is this? What is this test? The person gives a book to you, and you hold the book in the hand like this. You hold the book in the hand like this. So this is adduction of the thumb. Adduction of the thumb, and this is what we call as book test. So which is the muscle doing adduction of the thumb? Adduction of the thumb. That's the adductor pollicis. That's a test for adductor pollicis. That's the book test. That's the book test for adductor pollicis. Is this clear, students? So these are the various tests. ये clear है ना तीनों टेस्ट? That's a pen test. This is the card test for the adductor pollicis. And what is this? This is the book test. Now just one thing you tell me, students. One thing. If the median nerve is injured, if the median nerve is injured, tell me which movement of the thumb would not be affected. Understand this now. If the median nerve is injured, which movement of the thumb would not be affected? Can anyone answer this? What are the movements of the thumb? Flexion, extension, abduction, adduction, and opposition. So, अगर median nerve injury हो गया, so which movement of the thumb would be affected? So, what are the movements? Sorry, what are the movements of the thumb? We'll just make it like this. The movements of the thumb. 1, abduction. Chalo students, answer this. Movements of the thumb is 1 is abduction. And abduction of the thumb is done by whom? Abductor pollicis brevis, abductor pollicis longus. Now, abductor pollicis brevis is supplied by the median nerve, and abductor pollicis longus is supplied by the posterior interosseous nerve. Posterior interosseous nerve. So even though median nerve is damaged, will abduction of the thumb be lost? Will abduction of thumb be lost? No. Abduction of thumb will not be lost. Why? Because abductor pollicis longus intact hai, so that will do abduction of the thumb. Next is adduction of the thumb. Adduction of the thumb is done by whom? Adductor pollicis. Adductor pollicis and the first palmar intrausi. So both of this are supplied by whom? Ulnar nerve. Ulnar nerve. So adduction is not affected at all. Abduction, adduction ho gaya. Flexion. Flexion of the thumb is done by whom? Flexor pollicis brevis. Iske do heads hai, superficial and deep. Superficial head is supplied by whom? Median nerve. And the deep head is supplied by whom? Ulnar nerve. So this would not be affected. Anyone else doing flexion of the thumb? That's the flexor pollicis longus, and this is supplied by the anterior intraosseous nerve. Anterior intraosseous nerve. So flexion would not be affected. Extension. Extension of thumb is done by whom? Extensor pollicis longus and extensor pollicis brevis, and this is supplied by the posterior intraosseous nerve. Posterior intraosseous nerve is a deep branch of median nerve. It's a branch of median nerve. And last is opposition. Opposition of thumb is done by whom? Opponens pollicis, and this is supplied by whom? Median nerve. Only median nerve. So opponens pollicis is purely supplied by median nerve. So if the median nerve is injured, which movement of the thumb is going to be affected? Opposition. Opposition will be affected. Baki sub movements will be there, slightly there, because the other muscles are there to do these movements. Okay, other muscles will be there to do these movements. I'll tell Chandan, I'll tell. Clear? So this is how it is. So just understand all these things. Once again, somewhere or the other we'll discuss the movements of the thumb. Clear? So I just want you to be clear when if the median nerve is injured, which movement of the thumb would be affected? Opposition of the thumb. So students, some brief about our platform. Here we have got this NEET PG 2022 All India mock test on April 17th, 9 AM. Don't miss the dates. So this is a free calendar for the NEET PG students. April 18th we've got anatomy, 19th we've got biochemistry. Okay, Chandana. Oh, sorry, I'm so sorry, Chandana. Okay, April 20 is anesthesia, 21 is mixed bag, 22 is anesthesia, and 23 is again a mixed bag. For the NEET PG, these are all free tests. So we have got a plus subscription in which there are daily live classes, live quizzes, learning from the top educators, study from the device of your choice, and now you can also access our question bank. An iconic subscription where you get the best of Unacademy and pre-planner. Some special class features you have in which, one moment. So we have launched the Unacademy Live. This is a test series specially for you students. We are also launching the first Prof, the MBBS first Prof from 20th of April, this month now, 20th of April. We started with practice papers, daily practice papers, doubt clarification batch. And these are our toppers in the FMG exams, the recently held FMG exams. And some special class features in which there are daily live classes, live quizzes, poll for the learners, never miss a class, raise the hand technique. And if you miss the class, you get lecture notes in the form of PDF. Anywhere, anytime you can attend the class and get your doubts solved. So starting with FMG HILD 2022 revision and MCQ batch from April 20th. Download the Unacademy app and subscribe to it. Have a look at the plus subscription, the iconic and the light subscription. Especially for you students, download the app and subscribe to it. Yes, Chandana. Schedule YouTube lectures. I take some YouTube lectures and then some special classes on the Unacademy platform. So you can attend the special classes also, which I take, the special classes. These are all free lectures, the special classes. And there are new courses which will now be starting. Okay, I hope everything is clear to all of you. Thank you students, thank you. for this wonderful session, an interactive session. Thank you. I'll stop here.